We discussed the difficulties or challenges associated with cannulation. Let's take it a step further now, and because there are several challenges you might encounter during ERCP, and we have selected 3 cases that represent challenges in ERCP, and we would like to take the advantage of having experts here in the room and give their opinion on how to deal with that situation that every endoscopist performing ERCP will encounter. So we would like to have a discussion-based approach to some complex ERCP scenarios. We will navigate treatment options, for example, for pancreatic stones. We want to understand the rationale behind the treatment of biliary leaks. We will share, of course, our experience with some of the experts in this field, and we consider the importance of a multidisciplinary approach in the endoscopic treatment of biliopancreatic disease.
I'm going to present the first case of this decision-making session. It's a procedure about metallic stenting in hilar biliary stenosis we did at the UZ in Brussels. So the objectives of this case is very practical. So first, how to know which branches to drain if you have a hilar stenosis. Next, of course, very important, how to get the wire in the right branches. And then always the typical discussion, will we place plastic or metallic stents for this hilar biliary stenosis? She was diagnosed in 2023 with gallbladder/cholangiocarcinoma in a metastatic setting. She received first-line treatment with Gem/Cis and durvalumab, but unfortunately she had a progressive disease and she needed a switch to another alternative chemotherapy. And during she received this therapy, she presented with icterus, so it was a new complaint with an elevated bilirubin of 7.9, but no fever and cholangitis. At that point, of course, imaging was performed. She was restaged, and there was a new dilation of the intrahepatic bile ducts, as you can see on the CT. There was performed an ERCP in the referring center, and it showed a hilar obstruction, probably due to compression, but there was no possible selective cannulation of the left side. So first, I will show the radiography images of this case. I started with a straight long wire and a papillotome. That's always the first choice with what I begin. And as you can see, the first wire was easily placed in the right side of the bile ducts, as you can see here. Then we gave a little bit of contrast, not too much, to see the right side of the bile duct. Here you can see the common bile duct, then there is clearly a stricture, and then higher a dilated bile duct. But on these images, it's not directly clear what is the right system. It is completely the right biliary system. Is this left? Or is there still a branch missing, as we would suspect? Or is there a branch starting in the obstruction, in the hilary obstruction?